Hello everyone, and welcome back to the Senior Male Vitality Health channel. This is where we explore scientific knowledge that is easy to understand and practical, helping you maintain lasting health over the years. As we enter old age, our bodies go through many complex changes. Among them, there is a topic that is often overlooked and sometimes misunderstood. That is the importance of staying connected with your body through personal sexual health care. Many of you may have thought that after a certain age, this is no longer important. But is that really true? According to Dr. Kevin T. McVary, Professor of Urology at Northwestern University Medical School, maintaining personal sexual health in old age is not only related to vitality, it also directly affects hormone health, prostate function, urinary health, brain health, the immune system, and even mental well-being. In today's video, we will explore what may happen if older adults completely stop maintaining this gentle connection with their bodies. Please stay with us until the end of the video, and if you find this topic helpful, feel free to leave a comment and share your thoughts. Decline in prostate function and urinary system. As we age, the organs in our bodies gradually go through silent changes that many people do not notice at first. One of the organs most noticeably affected is the prostate gland. This small gland, located beneath the bladder, is responsible for producing fluids that support male sexual function and is closely related to the urinary system. In younger years, the prostate is regularly active. The fluids it produces are consistently circulated, preventing any buildup. However, as people grow older, many tend to completely stop activities related to personal sexual health. This may seem harmless, but in fact, it changes the internal environment of the prostate. Fluids that remain stagnant for long periods can lead to mild inflammation, swelling, and if prolonged, may result in benign prostatic hyperplasia BPH. This enlargement puts pressure on the urethra, the tube that carries urine out of the bladder. As a result, the person may experience uncomfortable symptoms such as frequent nighttime urination, weak urine stream, feeling of incomplete emptying, or a constant urge to urinate even when the bladder is not full. In more severe cases, the person may suffer from urinary retention, urinary tract infections, and may even require medical intervention. Many studies from professional organizations such as the American Urological Association, AUA, and journals like the Journal of Urology have shown that maintaining regular and scientifically appropriate sexual health activities can help reduce the risk of inflammation, swelling, and prostate enlargement. When the body engages in gentle activity that follows its natural rhythm, the fluids inside the prostate have the opportunity to be discharged regularly. This helps reduce the risk of buildup and infections while supporting stable urinary function. Caring for the prostate does not require complicated methods. By simply understanding the role of gentle, age-appropriate sexual activities, older adults can help protect their urinary health and naturally improve their quality of life. Decline in clarity and cognitive ability. In addition to changes in the prostate and urinary system, the decline in brain function is also one of the silent but important consequences when older adults completely stop appropriate male sexual health activities. In old age, the brain naturally faces the risk of memory loss and decreased concentration. However, the lack of gentle stimulation for the body may cause this process to accelerate. Each time the body experiences natural male sexual activity, the brain releases a series of important chemicals such as dopamine, serotonin, and oxytocin. These substances play essential roles in maintaining clarity, improving memory, enhancing concentration, and stabilizing mood. Besides providing immediate comfort to the brain, they also help protect nerve cells, maintain stable neural connection, and support blood circulation to the brain, when the body lacks these stimulations for an extended period, the levels of these natural protective substances gradually decrease. As a result, many people begin to experience forgetfulness, difficulty concentrating, and reduced motivation in both work and daily life. At first, it may only involve small things such as forgetting names or forgetting the purpose of entering a room. But if it continues, cognitive dullness may worsen and affect overall quality of life. In addition, testosterone, a hormone that plays an important role in maintaining alertness, decisiveness, and energy, it can also drop more quickly when the body lacks natural sexual activity. Lower testosterone levels not only affect male sexual function, but also influence memory, clear thinking, and confidence in daily life. Some studies published by organizations such as the NIH National Institute on Aging have shown a connection between reduced sexual activity and cognitive decline in older adults. Although it is not a direct cause of serious conditions such as dementia, the lack of this natural stimulation makes the brain more sluggish and less flexible. Gentle and regular male sexual health care not only benefits the body but also helps the brain maintain clarity and sharp thinking even as age continues to increase. Sen, emotional imbalance and increased feelings of emptiness. In addition to mental clarity, emotional health is also extremely important in senior health care. However, when gentle activities related to male sexual health are no longer maintained, many people begin to experience subtle yet persistent emotional changes that are difficult to notice at first. Each time the body engages in natural sexual activities, the brain releases powerful mood-regulating substances such as oxytocin and endorphins. These substances help soothe the mood, reduce stress, create relaxation, and bring a gentle sense of happiness. They function as an internal balancing mechanism, helping older adults maintain emotional stability even when facing many challenges in daily life. When older adults completely stop male sexual health care, these regular waves of hormone release no longer occur as before. As a result, emotional states may easily fall into emptiness, indifference, or a loss of interest in activities that once brought joy. Sometimes they may not clearly feel either happiness or sadness, only remaining in a vague emotional state that they themselves find hard to explain. Many people mistakenly believe these feelings are simply part of aging. However, most symptoms such as emotional fatigue, loss of interest, and withdrawal from social relationships may actually be related to the lack of natural sexual activity that helps both the body and mind maintain balance. If this emotional instability persists without proper attention, older adults may fall into a cycle of mental fatigue, reduced life energy, and increasing distance from relationships. Sometimes it may simply feel like no longer being interested in former hobbies, speaking less, sleeping more, or avoiding community activities. Maintaining a gentle connection with the body in a way that is safe and suitable for senior health is one of the natural keys that helps the nervous system regularly release mood-regulating substances. Through this, older adults can maintain emotional balance. I feel more joyful and stay connected with life each day. Sit, decline in sleep quality. Sleep plays a very important role in overall health, especially as we enter old age. At this stage of life, sleep often becomes shorter and more easily interrupted due to many factors such as hormonal changes, chronic illnesses, or urinary problems. However, one silent factor that many people do not realize is the impact of completely stopping male sexual health activities on sleep quality. Each time the body experiences appropriate male sexual activity, the brain releases a series of substances that help the body quickly shift into a deep relaxation state. Among them, Oxytocin helps stabilize blood pressure and heart rate. Prolactin creates a pleasant and sleepy feeling. And endorphins help reduce stress and anxiety. At the same time, cortisol levels, the stress hormone, also decrease after gentle stimulation of the body. The harmonious combination of these hormones helps older adults easily enter deep sleep and maintain a stable resting state throughout the night. However, when the body lacks these natural sexual activities for a long period, it loses one of its natural biological rhythm regulators that existed since youth. As a result, many people begin to experience difficulty falling asleep, waking up in the middle of the night, or sleeping without feeling truly rested. When sleep is continuously disrupted, the consequences are not limited to feeling tired the next day. Prolonged sleep deprivation in older adults increases the risk of memory decline, weakened immunity, worsened cardiovascular conditions, higher risk of falls, and may even affect life expectancy. In reality, many older adults who suffer from poor sleep for a long time often rely on sleep aids. However, depending on medication can bring unwanted side effects. Meanwhile, maintaining a gentle connection with the body through scientific male sexual health care is a natural and safe method that supports sleep in a sustainable way. Good sleep is not simply about lying in bed for enough hours, but about the ability to enter deep sleep, restore energy, strengthen immunity, and maintain mental clarity in daily life. Luke. Weakening of the immune system. In old age, the immune system naturally shows signs of decline due to the aging process. However, when male sexual health activities are no longer maintained regularly, the body loses one of its important immune support mechanisms that few people notice. Each time the body engages in gentle sexual activity, the nervous system and endocrine system simultaneously activate beneficial natural chemical reactions. Most notably, there is an increase in immunoglobulin A IgA. This is a frontline antibody that helps the body fight off disease-causing agents such as bacteria, viruses, and yeast, and provides strong protection for the respiratory and digestive systems. Along with this, endorphins are also released, acting as natural anti-inflammatory agents that help soothe mild inflammatory responses in the body. When older adults completely stop male sexual health care, these cycles of immune boosting gradually disappear. As a result, the body's natural defense ability weakens over time. Older adults become more susceptible to colds, respiratory infections, digestive problems, and even the recurrence of previous chronic inflammations. This is not simply a matter of catching colds or the flu more often, but also increases the risk of more serious illnesses as old age progresses. As the immune system weakens, the body's ability to control inflammation also decreases, which accelerates cellular aging and increases the risk of cardiovascular disease, type 2 diabetes, arthritis, and other chronic conditions. Many older adults often complain that their bodies are weakening quickly without knowing the reason. In fact, the lack of appropriate sexual activity over a long period may be a deep cause that leads the body to lose its ability to regulate homeostasis, making the immune system slower and less effective. Maintaining a gentle connection with the body through male sexual health care not only helps relax the mind, but also serves as a natural biological exercise that reminds the immune system to stay ready to protect health at every stage of life. Luke. Weakening of the immune system. In old age, the immune system naturally shows signs of decline due to the aging process. However, when male sexual health activities are no longer maintained regularly, the body loses one of its important immune support mechanisms that few people notice. Each time the body engages in gentle sexual activity, the nervous system and endocrine system simultaneously activate beneficial natural chemical reactions. Most notably, There is an increase in immunoglobulin A IgA. This is a frontline antibody that helps the body fight off disease-causing agents such as bacteria, viruses, and yeast, and provides strong protection for the respiratory and digestive systems. Along with this, endorphins are also released, acting as natural anti-inflammatory agents that help soothe mild inflammatory responses in the body. When older adults completely stop male sexual health care, these cycles of immune boosting gradually disappear. As a result, the body's natural defense ability weakens over time. Older adults become more susceptible to colds, respiratory infections, digestive problems, and even the recurrence of previous chronic inflammations. This is not simply a matter of catching colds or the flu more often, but also increases the risk of more serious illnesses as old age progresses. As the immune system weakens, the body's ability to control inflammation also decreases, which accelerates cellular aging and increases the risk of cardiovascular disease, type 2 diabetes, arthritis, and other chronic conditions. Many older adults often complain that their bodies are weakening quickly without knowing the reason. In fact, the lack of appropriate sexual activity over a long period may be a deep cause that leads the body to lose its ability to regulate homeostasis, making the immune system slower and less effective. Maintaining a gentle connection with the body through male sexual health care not only helps relax the mind, but also serves as a natural biological exercise that reminds the immune system to stay ready to protect health at every stage of life. C. Gradual loss of connection with self and personal value. In addition to the effects on physical and mental health, completely stopping male sexual health activities in old age also creates a subtle but very important impact on one's sense of self. It is the feeling of gradually losing connection with the body and diminishing personal life value. For many decades, the human body has always maintained a close link between the physical and the mental. When natural sexual activities still take place regularly, the sensory nervous system continues to recognize every part of the body. These signals remind the brain that the body is still vibrant, still full of energy, and still worthy of care. However, when male sexual health activities are no longer maintained, the communication between the brain and body becomes sparse. The sense of familiarity with oneself begins to fade. Older adults may gradually lose interest in personal appearance, eat more monotonously, exercise less, become reluctant to socialize, and slowly withdraw from relationships. Many people share that they feel like they are only existing in their bodies rather than truly living. This not only affects the mind, but also indirectly reduces overall health quality, as the lack of motivation for self-care increases the risk of chronic diseases. Maintaining gentle male sexual activities is an important part of helping older adults preserve a positive connection with themselves. When the body continues to receive attention, the brain receives the message that the person is still taking care of their health and still desiring to live well, and still cherishing each day of old age. Taking care of the body, even if it is only simple and safe sexual activities, is actually a way to remind oneself of life's value, of presence, and of the right to continue enjoying the good things in life, regardless of age. As we enter old age, our bodies go through natural but challenging changes. Many people mistakenly believe that changes in male sexual health, emotions, sleep, or memory are simply the inevitable laws of time. However, as we have explored throughout today's content, completely stopping male sexual health activities can lead to a series of silent but profound consequences. From the decline in prostate function, urinary disorders, to reduced mental clarity, emotional imbalance, weakened immune system, and the gradual loss of connection with oneself, All of these are closely related to the absence of natural, safe, and age-appropriate sexual activity. What is important to emphasize is that male sexual health care in old age does not mean complicated behaviors or chasing unrealistic standards. It is simply a way for each person to maintain a gentle and natural connection with their own body as an essential part of comprehensive health care. However, everybody is unique. If you have concerns or face specific health issues, do not hesitate to consult with a specialist or trusted healthcare professional. They will provide you with the safest, most scientific, and most suitable guidance for your current health condition. If you find today's content helpful, please leave a comment below the video to give us more motivation to continue sharing even more valuable knowledge. In the next video, we will continue to introduce simple exercises to strengthen the pelvic floor muscles, improve urinary control, and enhance vitality in old age. Please stay tuned.